Okay. Hello, my name is Brittany Kobley, and I'm a Master's of Public Health student. And yeah, I'll get started. So I would like to start by acknowledging everybody who really helped me and supported me through this practicum process. So a big thank you to my supervisor, Kathy Easton, as well as the Child and Youth Health Network, where I spent most of my time, and Island Health, and then of course to the UVic faculty, my first and second readers, Nigel and Kathy. So as I said, I was with the Child and Youth Health Network in the Capital Region. So that is locally here in Victoria. And they're an intersectoral collaboration of community organizations, municipal and provincial representatives, and the Capital Region District, as well as Island Health. And the network aims to improve the health and well-being of children and youth in the Capital Region, and this is really seen in their vision statement. So my culminating project and paper, when I started to work with them, they were just kind of looking at really renewing and revisiting their vision and mission, and really concretely defining a priority initiative. So they were working with BC Healthy Communities, getting some coaching for this, and my job was to act as the working group lead. So they had already kind of narrowed down their key leverage point to improve child and youth health, and they identified this as youth mental health. So I was coming in to really narrow that area down a little further with them. So this process, throughout this process, I really had to remember with my methodology that it was a community-led group, so addressing child and youth health and well-being in the Capital Region. So there was really a strong importance placed on investigating the issue from a local context. So although I performed many literature reviews to support this project, particular importance again was placed on local sources as well as local experts to define the youth mental health issue. We wanted to know what the youth were reporting and suffering from locally, what the local incidence and prevalence rates were of certain ailments, and were they on the rise in our community. Once this information was compiled, so that was me doing a bunch of literature reviews, once I compiled all the Island Health data as well as the South Island McCreary reports, then I was able to take that information to our working group as well as the community experts who confirmed our area of focus drawing on lived experience. So this is just providing some background context to the issue, the broad issue itself. So 70% of young adults say mental illness symptoms begin in childhood. Rates of mental illness are expected to rise to 1 in 2 by 2041. Currently, they're 1 in 5. And BC youth aged 15 to 19 years have the highest rates of hospital presentation for mental illness. And this is actually increased by 73% from 2009 to 2013. So then we began to really look in on the local context. So South Island youth, as you can see, are most frequently reporting depression and anxiety. The most prevalent disorder on the island is in fact any anxiety disorder, and there is a strong overlap between these disorders in youth. So this kind of set our tone for where we were going to move forward, so we decided to focus on anxiety and depression. Just a little context too, we weren't going to focus on, we realized this was a community-led initiative and that we weren't going to have any great impact on a severe depressive disorder. So we were really focusing on any problematic anxiety and depressive disorder or symptoms. And that's when the symptoms interfere with everyday activities. So reasons why this became our focus issue are listed right here. So 90% who commit suicide have a mental illness, with the most common being depression, affecting 60%. Among youth living in insecure housing, loneliness and depression was the top reason for recently self-harming. Youth reporting depressive symptoms were more likely to miss school. That's 55% versus 38%. Marijuana use is higher among youth living with anxiety, so 49% versus 23%. And depression, 52 versus 23. And then youth who use marijuana are also less likely to graduate. So once we really narrowed down our issue, we wanted to look at a strategy to address this issue and prevent this issue within our population. So our strategy is connectedness. And it is a psychological state of belonging in which individuals perceived that they are valued, cared for, trusted, and respected by individuals and communities with whom they are in regular contact with, so peers and family relationships. Now, connectedness does have subconstructs, and those are family, school, community, and peer. There's also new research into culture. As you can see, connectedness is a very subjective experience of one's feelings and perceptions about their social environment and attachment to others. Connections to family, school, and community are important for youth resilience, mental health, and overall well-being. And currently, the network is actually developing an index of connectedness, which will allow the community to understand it, measure it, track it, and compare connectedness across communities. So once we had identified our strategy, we wanted to make sure that this is actually, in fact, associated to anxiety and depression within youth. And we did identify that within the literature, connectedness is a protective factor. So it protects one against emotional distress, a wide range of risk behaviors. And as you can see, depressive and anxiety symptoms are 3 times higher among girls and 4 times higher among boys. And that's with low parental connections. High family connectedness equals low levels of health risk behaviors, and high family connectedness equals low probability of growing social anxiety. So it does actually even combat youth who are already struggling with the disorder or symptom. So we narrowed that down then to some evidence-based strategies. So connectedness can be easily understood as it is a human need to feel connections, and therefore I believe can be an easily implemented strategy across our society. Within the literature, connectedness was revealed as the greatest potential protective factor with that was family connectedness, with school connectedness coming in second, as it reaches all youth, including youth that are potentially lacking connections in other areas. So I found that fact very interesting, because usually we are worried about missing vulnerable populations that may not attend school, but in fact, some studies found that when youth were surveyed, 71% were attending school and reporting that those connections they made at school were in fact important. So some of the strategies that I came across, the top one, supporting, educating, and investing in family rituals. So family rituals could be eating regular family meals together. Consistently within the literature, family rituals are associated with higher levels of social connectedness and lower levels of depression. Local McCreary data also found youth who regularly ate meals with their parents reported higher levels of positive mental health. And then for a school connectedness strategy, as you can see, the third one down, consultants to complete routine school connectedness assessments. Their presence in the school environment makes them available to educate staff with respect to school connectedness promotional strategies. So that could be involving youth in school classroom decisions, rewarding student effort over achievement, and building strong relationships with all students. And that's it.
Questions? Oh, there you go.
Great presentation. Really,
you.
really enjoyable to listen to you present that. So I was just thinking while you were presenting this about the whole talk about legalization of marijuana in Canada.
Yes.
And I'm just wondering, like, there's always this perception that's viewed like as a soft drug and it doesn't have any long-term effects. But obviously, based on your research, there are, especially for adolescents. And I'm wondering if there's if this is going to contribute perhaps to mental health issues in the future. And if so, are there any public health strategies that would try to mitigate these issues potentially?
That's a really good question. So within my research, I didn't get really deeply into marijuana use and mental health, specifically of how it was going to impact that, but it does, in fact, they were showed to have lower rates of graduation, and they found when they had surveyed youth with the Mercury data, they believed that youth were using the marijuana as a way to self-medicate for these disorders. So I'm not sure.
Any more questions? Oh.
Hey, there was this statistic. I might not get right, but it was something like it. You said at the beginning something along the lines of 1 in 5 people.
Yeah.
And then it was by 2040, it was 1 in 2.
Yeah, 2041.
I'm just kind of wondering. I'm sure we could spend all day talking about this, but why now that I find there is so much more focus on mental health and mental health issues? What are some of the reasons that you see about why this is growing at such a rapid rate in youth? Like, what are some of the ones that you can?
Yeah, so there's a lot of theories behind it. Of course, our ability to diagnose now is greater than it may have been. And then there's also, I kind of think it's a bit of that, and then it's also a bit of fundamentals, like our society has shifted, and our value on intrinsic and extrinsic has kind of shifted as well. So we place more value on success and material items and all those things. That's what the research says, at least theorizes.
Thank you. Yeah, that was actually what I was thinking, because it's quite a horrifying graph to see that. And I just wondered, was that based somewhat on projections up to now being, in terms of how much confidence do they have in that? Is it based on previous projections that have predicted where we are now, so they've got some confidence in that curve, or is it sort of...
I believe it was based on the previous projections of where we are now, and it was the Canadian Mental Health Commissions Act that piloted that paper.
Right.
I just had one last quick question. Basically, did you come across anything in your research that linked anxiety disorders in youth with early childhood education? Or not necessarily between 0 and 5, but just 0 and 10?
We had already kind of narrowed down that our strategy would be connectedness, because they are developing a connectedness index, so we didn't get into any early childhood education and how that. But we do know that school connections in early years are important for later years connections.
I've got one final question, and that is related actually to recent immigrants. Obviously young individuals have greater pressures trying to integrate, etc., language issues. Have you seen any evidence that the incidence of anxiety and depression are higher in those individuals?
So I did try and look for that to see if there was. Unfortunately, immigrant populations are underrepresented within the literature, within the research articles, but it was identified as a risk factor. A recent change, so that could be moving to a new city, new school, as well as immigrant populations were identified as at risk.
Right. Thank you very much. It's really,
Yeah.
really
Thank
interesting
you.
talk.